Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we have the most famous physical therapists on the internet.
In our opinion, of course, Bob.
We'll probably get accused of abuse of the skeleton.
Yes, Bob. Why, Bob?
This is
Why?
Sam the skeleton. Today we're going to talk about the secret reason infrared heat can heal neck, back, shoulder, hip pain, and more. We're big fans of the infrared heat, and we're going to show you in a minute why.
Right.
If you are new to our channel, though, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to, we got all sorts of platforms here. You're going to want to join us on the Instagram now.
Sure.
Insta Gangsta.
Graham Crackers.
Graham Cracker. Instagram. We're official Bob and Brad. You're going to want to join us on Facebook, Bob and Brad, because we are nearing 1 million subscribers, Brad.
Right.
And when we hit 1 million, we're going to do a huge giveaway. And it's going to be, a lot of it's going to be on Facebook.
Right, and it's going to be some good stuff.
Yeah, we're on Twitter, and we have a website too. So.
Of course.
Okay, so with a regular heating pad, what a lot of people don't realize, Brad, it doesn't matter if it's moist or radiant heat. It only penetrates like a few millimeters.
Right.
And that's indicated by this red right here.
Right. You can figure, a 1/4 inch at the most.
Right, 1/4 inch. Now with infrared heat, we're going to move right down, and we actually have how many inches, Brad?
2.36.
2.36. Look at the difference between that. Look how much more that penetrates.
Right. So the red area represents the depth that penetrates by infrared, and on the opposite end of the stick, it shows your typical convection heat.
So 2 to 3 millimeters versus 60 millimeters if
Sure.
you want to go to the metric system. Now, why this makes a big difference, I'm going to show you first how it makes a big difference on the spine. So if you got, this is the spine. If I pulled it right off of Sam here, your head would be here normally and the legs come off here. But if you look closely here, and Liz, I guess we didn't practice this, did we? Should I get closer to you? So there's little joints here. At every level, it's a joint, just like almost like a knee joint. A joint on this side, joint on this side, facets.
Yeah, facet or facets.
Facets.
Depends
right.
what part of the world you're from.
So I pull apart there, you can actually see 2 of the joints there.
Right, there we go.
So every level of the neck has, so we have 14 joints in the neck. You've got the mid-back, you got 24, and in the low back,
10.
Good math.
Unless you got 6 lumbar, but one way or another. And that's where you're going to get arthritis in your back, is in the facet joints.
And that's where it's going to hurt.
Right.
So if you use regular heat, and you got a picture, there's got to be some skin over the top and muscle and all that. You can see it doesn't even get to the joints.
It gets through the skin maybe.
Right.
And then that's it.
But if you use 2.36 inches, 36?
Yep. 2.36, there we go. You can see, even if the person has a little subcutaneous tissue, in other words, fat, it's still going to get through there and get to those facet joints. And it's going to go through the muscle as well, and the muscle is going to get warmed up, increase circulation, all those things that heat does that we want it to do.
Now, I use the Thermotex every night in my chair.
Yeah.
Definitely during the winter months. But, and I get, a little bit of pain, what we call the knots, in the upper trapezius and the mid-back. And this is just my daily treatment for it. It takes it away. If it gets really bad, I actually take the straps. And I'm doing, if you're wondering why I have this thing on right now, this is the Thermotex infrared system here. I actually take the straps and I put them on here, and I put them around my shoulder, and I actually work with this on. I'll work at my desk with it on.
Sure.
Because what it does 2 things. One, it's giving me the heat to take away the pain, but 2, it's correcting my posture.
Right. So these are wide elastic straps. Should I snap them? No, I won't. But that reminds you to maintain good posture.
Right away, I don't know who you are. It doesn't matter. When you're working at your desk, eventually you start to slump like this.
Right.
And these help remind you and pull you back.
Right.
So it treats the pain 2 ways. 1, it puts you in good posture. 2, the heat helps calm it down.
Right.
Now, beyond this, though, what it also does, if let's say you're going to start working at some of your joints, let's say you're having shoulder pain, now you can put the Thermotex infrared system on both sides of the joint.
Right.
So if it's on both sides of the joint, what is it going to do? You're getting heat coming in from both sides. So now instead of 2.36, you're going to have 4.72 inches.
Getting close to 5 inches.
Now you're going to have that much. Now look at that. That goes right through the joint.
Right. So you've got nice.
That goes right through the joint.
And again, this is not aggressive heat. This is not going to get so warm that it hurts by any means. It's a very gentle,
very steady heat.
Right. And you put it on and you won't feel it in the first couple minutes like a typical standard hot pack. It takes a little bit for it to get through. And
yeah, it takes about 10 minutes for it to warm up.
Right.
Some people, like they tell the story, the Thermotex company, they have one since 1998, Brad, that they've had in their Wendy has one in her office that she's had on since 1998.
I'm not sure, but I think they have it on a chair like this, so when you sit down.
Yeah, they also have one in their lobby since the year 2000, October 2000, and they just leave it on all the time, and it's been on. So that's a lot of years.
This is how I use mine, because my low back, my lumbar area is where I like to use it. And I have it in my recliner, so at night when I sit down to...
and see, I have mine in the mid-back. So I have 2 pillows, and I put it up, and I just lean up against it.
Yep.
Approved by the FDA. It's made in Canada, so it's also approved by Health Canada.
Sure.
Again, it's a real steady heat. It's very inexpensive to run.
Right.
4 cents. What they recommend, by the way, is that you use it twice a day if you're trying to heal or try to get a lot of blood flow to an area, which helps an area heal, right? I mean, especially if you have muscle injuries or something like that.
Therapeutic treatment. Mm-hmm.
So they recommend twice a day for 45 minutes, 10 minutes for it to warm up, then you get about 30-some minutes of treatment. And the thing is with that is that sounds like a lot, but if you can do it while you're doing something else, it's not really a treatment.
Right.
I mean, if you're doing it while you're watching TV or you're doing it while you're working, it's really easy to get it in there.
Yep. I like to do that. I sit on my recliner. I got a laptop that I put on a little hootenanny, and it's very nice.
Hootenanny, that's an old term there.
Well, you know.
What are you, 100 years old?
It did come from my mother. She's not 100. Must have been my grandmother.
By the way, if you use the link down below, we got a discount for you, a pretty sizable discount that they'll give you on this. And they do have, this is the platinum model. This is the most popular model. Brad is going to show you different ways to use it. Why you can pretty much use it all the way from the neck down to the shoulder to the, he's going to show right now the hands.
Right. Yeah, they have models for the hands, for the feet. But if you just want to buy one that'll treat the whole body, the platinum is the way to go because you can make a muff out of it. I got both hands in there.
Well, pull one out, Brad, once. Pull one hand out. Now look at this. If he's got it on both sides of the hand, see how that's going to go all the way through because he's got the panels on both sides of the hand.
Right. So if you've got arthritic problems or something,
it's going to go all the way through and get the fingers and get everything all together.
Look at that.
You can get the elbow.
Slides right up to the elbow. And they got some really nice, I'm not just saying this, but really nice elastic with good Velcro. You can hear it snap.
Well, good cord too.
Yeah.
What is that, 6-foot cord? Did we decide?
Well, plus the whip.
Yeah.
I call this the whip where you can easily attach.
It's like a commercial cord.
It is, yeah. There's nothing cheap about that. You can get the shoulder around, and then the hip. You're going to do it here. And this works nice, particularly in a chair with an armrest, so you can kind of trap it in there and just relax with it there. There we go. Around the knee. I always like to, if I'm doing this with a patient, I'll have them put their knee up so they feel comfortable and then wrap it around here. Like
yeah, interestingly enough, I've been using it in the clinic now all the time. What's nice about it, you can go right through clothing. Right. It doesn't even have to be, all conform right to the surface there. The heat, radiant heat goes through, not the radiant heat, infrared heat.
Infrared, yes.
Goes through even if you're not touching because these panels are a little bit stiff, so they don't conform to you as much as, but they don't need to.
Right, and they don't need to. That's the advantage, one of the advantages of the infrared. So here I got, hip, knee, ankle, shoulder, elbow, hands, back, upper back, low back, neck. You can do it all with this. Now, the ones that are custom for the joint do work a little bit better.
Yeah, that one for the foot my daughter uses. She just slips her, it's like the big shoe or the big slipper they call it.
You can get both feet in there.
You slip your feet in there, and you'll see them when you go to their website. So, again, we're big fans. We're not going to be ashamed of saying that. I mean, we use it ourselves, and we use it on our patients, and we think it works well.
Well, you better believe it. So,
all right. Thanks for watching.
A nice idea with the ruler power.
Yeah, now you can see visually.
Visual, 2.36. And some people, in the metric system, or if they 60 millimeters.
Yeah, we're a visual society.
Yeah, we need whatever.
All right, thanks for watching.